Good afternoon. My name is Michael Johnson. I'm the Assistant Director with the Merced County Department of Public Health, and I'm here to answer any questions you might have about our release that we put out today regarding our first measles case identified here in Merced County this year. The case of measles was confirmed by the State Public Health Laboratory this last week. The measles case was in a child here residing in Merced County. The child is under the age of 5 and is not in school. The child is recovering from the measles illness and is at home with the family. Measles is a very contagious disease, and so the health department took action under direction of our county health officer, Dr. Livermore. We've been working with the family to make sure that the child has received all the necessary testing and treatment. We also have contacted the family and are working with them to do our epidemiologic investigation. We are reaching out to all individuals who might have come into contact with this child, making sure that they don't come down with measles disease, or if they show any signs or symptoms of measles disease, that we would send them for the necessary treatment and testing to confirm. Receiving the MMR, measles, mumps, rubella vaccination is the best protection against measles disease, and the state has had a measles outbreak which has been going on since December of this past year. Through the 317 program, the state has expanded the provision of measles, mumps, rubella vaccine. So in addition to the children, we're able to actually provide that vaccine for adults. So we're advising at this point that the best protection is to make sure that you are fully immunized. MMR vaccine is available for children age of 1 and older. There should be 2 doses of vaccine for children, one at the age of 1, between 12 and 15 months of age, and the second dose when they start school. 2 doses of MMR vaccine is considered to be protective against measles. The signs and symptoms of measles is very important. So if anybody identifies any of the signs and symptoms, which are usually commence with a moderate fever, accompanied by a cough, runny nose, red eyes, 2 or 3 days later after a fever spikes, maybe up to 104 or 105 degrees, a blotchy red rash will appear, usually first on the face and along the hairline and behind the ears. The rash spreads rapidly down to the chest and back, and then eventually down to thighs and feet and extremities. If an individual believes they might have measles, they should contact their primary care physician. We're strongly encouraging individuals to call their physician's office in advance. We don't want to unnecessarily spread measles, so we don't want individuals just presenting, sitting in crowded waiting rooms. If they believe they might have measles, they should contact their doctor in advance. That physician's office will work with us, the local public health department, to evaluate whether that individual has measles and any additional actions that we might take, such as further epidemiologic investigations. Well, because we don't know how the child got the measles, we don't know exactly the time that the child was exposed to measles. So, but we do know that the child was infectious, I think it was through the 23rd of February. Well, if an individual comes down with measles, there really isn't a whole lot that you can do. The disease tends to just need to run its course. However, they need to run the course with medical care. So like some other diseases, it's like supportive care. So making sure that the child gets plenty of rest and fluids, and they can do fever control. And part of that is because we're focusing on making sure that the disease doesn't advance to a more serious issue. Many people get measles and pass through the disease without any long-lasting problems, but there are rare occasions where individuals can have more serious issues. It can, turn into pneumonia. Yeah, other complications. So it's very important that that if they believe they have measles, that they work with their primary care physician. But we don't know if this case is directly related to the Disneyland outbreak. We have some additional testing going on at the state to see the strain. I do know that the state has reported that there are actually 3 different strains of measles occurring in the state at this point. And only one of the 3 is definitively connected to the Disneyland outbreak, so we'll find out the information at some point. At this point, I think the vaccine is the most important method to stay protected, so that's what we're recommending and encouraging everybody to review their shot records, make sure that they're doing what they can to protect their family. In Merced County, we actually have a very good immunization rate. Our school immunization rate is, in many schools, 99% or higher. And in that respect, that is actually very protective for our students in Merced. And they worked with their primary care physician to have the testing done. Again, the testing that is conducted, the samples are drawn from the suspect cases. There's several different types of samples. There's a nasal swab or a throat swab, as well as a urine sample. The Public Health Department, when they have a suspect case that meets the potential clinical definition of a measles case, will work with the state health department, and we'll package those samples here and send it to the state public health lab in Richmond, where they do the testing, and then they send us the results. Measles, we haven't had any cases of measles in Merced County since 2011, and prior to that time it might have been quite a number of years. So many doctors go for a long period of time without seeing measles. So encouraging them to consider measles as a potential diagnosis is very important. So we have had a number of suspect cases that we have ruled out since late December. And this is the first one that actually came up as an actual case. That's one of the challenging things about measles, is it's highly infectious. So when you have an individual in a room with individuals who are not protected, it frankly is fairly easy to transmit that. They don't have to come into direct personal contact. It's airborne. And that's one of the reasons why measles is such a serious illness and really important to track.